Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist, and in today's video I am going to go over a few simple exercises that are really amazing to help with stiff fingers. Unfortunately, fingers can get stiff very quickly after an injury or a surgery, and that can be really challenging to get them moving again. And the bad thing is that if you don't work on them early and often, they can become permanently stiff. So I want to share with you a few simple exercises that you can start working on as soon as you are cleared by a doctor or surgeon to do so. Let's go ahead and get into it. Okay, so the first exercise that we are going to practice is a passive range of motion or assistive range of motion for the big knuckle of the finger, which is called the MCP joint. So what we're going to do is bend that joint using the other hand to help. So I'm going to demonstrate with my pinky finger here. So I'm trying to bend the MCP or big knuckle. The rest of my hand can stay relaxed, and I'm going to use my other hand to gently bend that joint down as far as I can get it to go. Generally with stiff fingers there will be some discomfort, so we're trying to find that uncomfortable range where it feels like a stretch, and then holding that position for about 30 seconds. So the longer the better, and we want that prolonged low load force. So stretching out that big knuckle of the finger. And you could go down the line, stretching the next finger, your ring finger, and then your middle finger, and then the index finger. So over time, that's going to help us to get these big knuckles down to be able to make a fist gradually. So that's going to be the first exercise. The next movement that we're going to practice is another passive stretch or a assisted stretch for this time the middle knuckle or the PIP joint. So again, the fingers can stay relaxed, and this often helps if you're able to do it in a relaxed position on the counter, on your lap, on a pillow, something like that, so that your hand can just be relaxed. We're going to use our other hand to bend the middle knuckle down as far as you can get it to go. Take it till you feel that nice stretch or tension, that little bit of discomfort, and then holding for 30 seconds. And you can continue to do that on each of the fingers. And again, your other fingers can stay relaxed. I'm trying to hold them out of the way so you can see what I'm doing. And just going down the line with all of the fingers. The next stretch, we're going to combine those movements, and now we're going to try and fold the whole finger down towards the palm as best you can. So again, keeping your hand relaxed, and then you're going to use your other hand to gently bend the finger down into a stretch, folding it towards the palm like a fist, and then holding for 30 seconds. Now, when you have stiff fingers, they may not look like this, right? You might be out here or up here, but gradually we're trying to bring them down a little bit further and further as that tissue stretches out. So you don't have to necessarily look like my hand, which is uninjured. And going down the line. The final exercise that I'm going to share with you is a passive stretch for the middle knuckle of the fingers. So this time you're going to rest your hand in a neutral position, and we're going to work on straightening out that middle knuckle, which oftentimes is a little bit bent. This stretch might not be necessary if you are able to fully straighten all of your fingers, but often when fingers are stiff, they're stiff in both directions. So if you're not able to fully straighten your fingers out, this is going to be a really great stretch for that. You're going to put pressure on top of the finger, just behind the middle knuckle, and then you're going to lift up underneath the entire finger, not just the tip joint. The whole finger should straighten in that position. Now you can do this with your palm facing down or with your palm facing up. Either is okay. But again, you're going to put downward pressure on top behind the joint and upward pressure of the finger. And then holding for 30 seconds. Those 4 exercises are just a few of the many exercises that can be great for resolving finger stiffness, but I think it will hopefully be a helpful starting point for you, again, once you're cleared by your doctor to do so. I hope this video was helpful for you. If you enjoyed it, please give it a thumbs up, comment below, subscribe to the channel. I really, really appreciate your support and for taking the time to watch this video and enjoy. Hope you have a wonderful rest of your day, and I'll see you in the next one. Thank you so much for watching.